What happens those first 24 hours after surgery? That's something that many of us are scared about, and I can tell you even when I had my own surgery, I was a little uncertain. What will happen is when we finish surgery, you'll be in the recovery room, and you'll be there for about 30 to 45 minutes. Then Danelle, our recovery nurse, will help you get dressed and meet with you and your caregiver and go over all your discharge instructions about what you can and can't do for the next 24 to 48 hours. So many times people during this time period are still under the influence of all the medications. So you're most likely not going to remember any of this, which is why it's really important that Danelle speaks with the person taking care of you for the next couple of days. There are only a couple of things that I really want you to focus on. The first thing I want you to focus on is making sure you stay hydrated. And that means drinking fluids and eating light food. You don't want to go out and eat a steak because your stomach is still going to be a little unsettled from the anesthesia. So I would just say some light food, crackers, chicken noodle soup, but you definitely want to eat something and you definitely want to keep it light, but drink a lot of fluids. The other thing I want you to focus on is to make sure you're getting up and walking around your house every couple of hours. It's really important that you walk a couple of minutes, walk around your bedroom, walk to the bathroom, and do those kinds of things, and make sure you're peeing as well. And that's partly because walking helps to reduce the risk of blood clots in your legs called DVT, which can travel to your lungs. And that's a really significant problem if that were to occur. And the best way to prevent it is to walk. Also, by walking, you're going to keep your GI tract moving. You're less likely to have the issues with constipation and gas and bloating because everything is going to move through your GI tract. And that'll also help you to pee. And it's really important that you do pee after surgery because sometimes the anesthetic medications can make your bladder a little sleepy, and we want to make sure everything is functioning well. The other thing you're going to want to do after surgery is you're going to want to make sure you use ice packs on the area that we operated on. Ice is a really good way to help with pain control, and it also reduces swelling and bruising. And I'll be honest, when I had my surgery last year, I was a really bad icer. And every time I saw my doctor or my physical therapist, they would always tell me how important it was to ice. And I can't emphasize that enough. The other things to remember are while you're resting after surgery, it's not bed rest. You want to take it easy, move around a little bit because you actually feel better if you're moving around a little bit. And that prevents some of that stiffness that can occur to your muscles. But listen to your body because your body is a really good indicator of what you can and can't do. The other most important thing about the whole process is remember, I see most of my patients after surgery within the first 24 to 48 hours. And a lot of people are like, well, why do you have to see me 1 or 2 days after surgery? And what I have found over the past 15 years is a lot of times it's very reassuring to both the patient and me because I like to know you're doing well. And then also you as the patient and your caregiver may have more questions now that you're in the midst of the recovery process. And I really like to address all those questions and concerns at the very beginning or as soon as possible.